Let me just say welcome everybody to this webinar. This is Empowering Church Health Outreach. I'm John Mills, and today we're going to be talking about making a pitch to a local funder. And we have Ann Langston and Jenny Koltnow from Church Health. These ladies have together raised untold millions of dollars for Church Health. Just nod your head yes. It's got to be true. And and they're going to sort of walk you through a mock pitch for a charitable clinic. And then afterwards, they're going to be talking about how to prepare your pitch locally. And then we'll have some time for questions and answers. So, ladies, I'll turn it over to you.
Okay, thank you, John. Well, we're going to do a little bit of role playing today, and since we're late getting started, we're going to jump right in as soon as Jenny closes the door that I so rudely left open when I came into her office today. Jenny, thanks for inviting me to come to your office today. It's good to see you.
Well, it's good to see you too, Ann. Thanks for making the time to catch up today.
That's just a special treat for me. So we haven't had a chance to catch up in several years, and you've got this role now with your family foundation, and I'm excited a little bit about what you're doing. I mean, I know the foundation has some interest, but I'm guessing that with your being involved, that may have changed a little bit.
Well, yes. So it's been very exciting to take on this role and not only work with family members, but members of the community, and really follow my grandfather's legacy in continuing to provide health care. So we're really looking to sort of revisit the relationships that we have and find new opportunities to fund organizations that are really taking good care of their patients and finding new and innovative ways to meet the healthcare needs of our community.
Well, y'all have done a wonderful job for a long time, and I had the pleasure of meeting your grandfather a long time ago, so you come from good stock. But what about you? I mean, what about your personal connection to that? I mean, you've a little bit of inherited a mission and an interest of the family. I mean, does that have any meaning to you at all?
No, absolutely. I mean, my grandfather and really the rest of the family really want to carry on a legacy and continue to support the healthcare needs of people. And, there's just a lot of people who aren't getting the care they need, don't know where to turn. And, even I had a situation, an incident myself a couple years ago with my daughter. And, I realized that in order for her to recover, we needed to rely on people in a number of different healthcare settings, and it got really complicated. And I'm fortunate because our family had the resources to find them, and I could hop in my car and take her to appointments and talk to friends and colleagues in the industry. But, I realize there's a lot of people out there that just don't have the resources we do, and perhaps our foundation can play a small part in making that whole process and making healing for a family that much easier.
Wow. Well, it sounds like we were meant to talk today then, based on what you've said. And I appreciate the chance because I know you've never had an opportunity to visit Church Health, and I hope you'll be able to do that. But let me see if I can just paint a bit of a picture for you about what we're about and what we want to do in the future. We've had 31 years of experience, but it's almost like every day is a new day when you are in this work and you realize that the length of the line outside the door may change, the number of people to serve may go up and down, but there's always going to be somebody in need. And I know you've been involved in understanding a little bit about the national health care as well as the local health care scene, but Church Health has been a part of that long enough, as anybody has that lives in a community, to see lots of changes. And we thought we had times in which there wasn't going to be a need for what we did. But I'll tell you, if you look at the current county health rankings, which are really important for you to keep up with in the business that you're in too, right now, I mean, at the very lowest, there are 110,000 people just in our small county that don't have any access to health care. And Jenny, that doesn't count the people that don't go counted in the census. I mean, we have a huge undocumented population here, and regardless of where you fall on what should happen there, they're working in our community and they're doing good things, and we feel a need to take care of all those folks.
Now, where does like Obamacare fall into the mix? Like, I mean, should people be enrolling in the ACA and getting health care in that way? Wouldn't that take care of it?
Absolutely. They should be enrolling in those exchange programs and getting care that way. And we want to encourage everybody that qualifies for any program, whether it's through their employer, through the government, through cost sharing and subsidies, however that happens. But I'm telling you, there are so many, and it's that 110,000 people that still don't qualify for anything. And it's hard for people to get their arms around that, but given about 90% of our patients make 100% or less of the federal poverty level, unless they fall into a special category that would get Medicaid coverage, they have nowhere to turn, nowhere at all. So the gap is so large, we would love to see that gap contract in every way possible. We are always advocating for that, but we know we must be in our mission and our calling where people continue and always will to fall through the cracks. I'll tell you a story about a few years ago. I sat with a very wise man that had been in healthcare a long time, and he asked the question as we were talking about whether we needed endowment funding. And it's an important one. And the question wasn't, what do you need to be doing, but does church health need to exist in perpetuity? And our mission is such in caring for people in body and spirit that we were able, after a very lengthy process involving a lot of stakeholders, to answer that question absolutely yes. Because you can't find a time in history or a place in the world where every single person has access to care. Now, what they don't have access to may change. One year you may have primary care and no dental care or no eye care or a number of other things. But we know for a fact that our mission is to move and to balance what we're doing to fill in those cracks. So that's what makes the difference. But the other thing I think is real important for you to understand, and living in a city like Memphis, you encounter people every single day that come to us as patients or need to. Because we do have a large unserved population. But these aren't people you don't know, Jenny. These are people that come into your home probably. You have a wonderful, cute new haircut. I'd love for you the next time you go to get your haircut to ask the person washing your hair if they have any access to care. Because one of the most amazing stories that touched me a number of years ago was a woman who was actually a patient of ours who brought the woman who washed her hair to our clinic. The woman was in terrible physical health. She had been working for years and years in the same job, but she was always on her feet. And she had never taken care of any of the chronic diseases that she had. And she was about to lose her job. That woman that brought her loved her. Turns out so many people that we probably all know knew this woman and cared a lot about her because she was so gentle and kind in her job. And she became our patient and still is. But that's the kind of person that's in our lives that we just need to stop and think about. And some days we even just need to ask the question and say where you're getting care. And what I would like for you to understand is the first thing you can do is say, I'd like for you to call and get an appointment or go to the walk-in clinic at Church Health because they can help you. But what do we do with that? And I want you to understand this in a little bit more depth because it's not just we have a doc in a box, as they say. We're not sitting out there in the local grocery store or drugstore. We provide what I consider to be the thing that we as Church Health staff are called to do, which is to do the very best we can for people that fall through the cracks. And those are some qualities in healthcare that aren't about how many pills or how many shots or how many tests. They're about being top quality, having very, very good providers. It's also about being accessible. It's not where you have to go through 18 layers to be able to come and be a patient. Affordable. We're not a free clinic. but we do want people to pay what they can afford and feel that they get absolutely the very best treatment that they can for that. And we want people to understand that we care more about than just their primary care. We care about their whole person.
Yeah.
So we may not be able to take care of those other needs, but we're going to work through our staff to find ways. So when you come in and you get a diagnosis and you don't know what you do with that, let's say you need some kind of orthopedic help, or you may need just a different kind of shoe to wear. We're not going to just say, Jenny, you need to go fix that. We're going to sit with you long enough to make a suggestion of where you go. Or if you need another referral, we're going to rely on all of those volunteer doctors and practitioners that volunteer for us.
Yeah.
So we may have a small staff of providers, but we have a myriad of other people in the community that are there to see us. So that's the depth of our service.
So I have a few questions, things that have just sort of bewildered me about church health. First of all, and you mentioned your volunteer provider. So why do these volunteers come to you? Because it is quite staggering, and even our family physician has volunteered the last few years, and but he's ready to retire, and so I think he's winding down. So I'm just wondering, how do you continue to get volunteer providers when so many of these folks are trying to crank out 45 patient visits a day?
Well, the good news is the ones are retiring young, and they're wanting to come and volunteer even more, which is an interesting trend over the last 5 years.
Yeah.
But back to your question, because I've asked a lot of our providers that, why have you been coming for all these many years? You've got a big practice, you still enjoy that. Every single, I think I can honestly say every single physician I've ever talked to basically gives the same answer. One, I love your patients. They are the most appreciative patients that I see anywhere, whether they're in my own office or if I come to volunteer on site. And number two, I'm able to give attention to patients at Church Health without worrying about the rest of the noise of the healthcare around me. I don't have to do anything administrative. I don't have to follow up with any other process after that. Your staff takes that and takes care of it. So you make it easy for me just to be a good doctor.
Gotcha.
That's what they tell us.
That's good to know.
Yeah.
All right, so another thing is that since I started leading our family foundation, my sister-in-law, who is Jewish, joined the board. And, there's been some concerns because the title, the name of your organization is Church Health. Absolutely. And, she and I've talked, and she wants to be more involved, but she's a little cautious about something that, like a organization that might not appreciate her tradition, or that of so many of our friends and other colleagues who may not practice as Christian.
Jenny, that's such an important question, and it's one that we get asked all the time, because from the beginning, Church Health has had a cross in its logo, and it's clearly based on a Christian foundation. But from the very beginning, we have reached out to any faith community. That just happens to be how we got started and what we care about. We feel as though the work in caring for healing other people and ourselves is the responsibility of people of faith. It doesn't have to be the faith that's identical to mine or to yours. In fact, we have probably the largest number of donors to Church Health that come from the local temple than any church in the city. And that's because we've ended up engaging those people in coming down here, volunteering, meeting physicians that volunteer. But it's not our work, it's their own faith that's led them here. We have a wonderful support from the Muslim community. A large group of Muslim doctors come and volunteer for us. And we're open to that. What we want to encourage is people to get in touch with their own faith tradition and to recognize how important that is to being a whole and healthy person. Now, that may not appeal to everyone, and we understand that, but that's where we as Church Health come from.
Okay. So, and then I know that Dr. Morris has been leading the organization for quite some time. What's his plan? Is he I'm sure he'd rather be on a beach somewhere. Maybe not a beach today, but
maybe not.
Beaches or something like that.
Well, you need to get to know Dr. Morris because he's been an ever ready buddy, and probably will keep going until he totally winds down, which I don't see that being anytime soon, and we all hope not. But this is a very serious subject. I think it's true for an organization from the very earliest days to where we are, and that is we have always have a backup plan for what happens if something happens to Dr. Morris tomorrow.
Right.
We have a staff that knows how to step in, how to run things, but more importantly, our board of directors sees this as a very serious responsibility.
Okay.
And they have an ongoing discussion with Dr. Morris and with the staff about succession planning, where that will go, how if something happened immediately, things would be taken care of, but also what they're planning to do over the next several years to make sure that we've moved in that direction.
Got it.
I can't say that I can open the door over here and introduce you who the next person will be, but I have a lot of confidence that there's the right mechanisms are in place and the thought's gone into that.
Okay, and then talk about your board for a little bit, because I know that your board chair is a big businessman, and you've got some clergy there. But who are because I've been doing this work in philanthropy for a long time. A lot of weak boards out there. A lot of people who show up to meetings a couple times, but we'd really like to know that the organization's in good hands.
Yes. Well, I'd love to give you a list of our board members, and I'll be happy to send that to you so you don't have to even look on the website to see that. I would say, Jenny, that our board consistently has been a very, very strong group of committed people. We've made a few mistakes along the way where people wanted to serve on the board, and we found out that they didn't know enough about us, and so maybe they didn't show up to board meetings. So over time, we've gotten to know people that come on our board and work with them for a little bit before they become board members. And we really spend a lot of time wanting our board to understand what our programming is about, how they can support our development effort, how they can be good spokespeople for church health out in the community. But most important, we want them to care about the mission. And I would venture to say, when I give you that list, that you could pick up the phone and call any one of our board members and say, I'm trying to learn about church health. What do you think? And I think they, one, will be very well informed, and two, incredibly committed. Every person on the board has a special talent, and we try to recognize that. Sometimes we don't use it as often as well as we should because we're all busy people, but when we do, we're always grateful. And I'll also say that I think our board has always been wise. Through the highs and lows of an organization, the board has to be a constant. And boy, they make good decisions. So I would encourage you to get to know them.
Yeah. So let me ask you one more question.
Sure.
So, I know you've had a big milestone reached this last year and a half or so, new space, and you've had some growth, but what are your priorities in the next couple of years? Where are you really?
Well, first of all, I want to just mention what you just said, because most people ask me this question. You've just moved into new space. I mean, now do you have a lot of money needs around that? And the answer is no. Actually, we've developed some efficiencies in our new space, and we raised the funding to take care of that move and our presence in this space, so it didn't detract from our operations and our ability to grow. So our priorities right now are to grow those areas of really critical need. We need more providers. We always do. People don't understand you can't deliver care if you don't have the people there to do the hands-on care. So looking for folks that are willing to help us build the funding to bring on a new doctor or a new dentist is right at the top of our list right now, as well as we really want to bring on a director for our eye clinic. There is no other resource in the city for caring for your eyes if you don't have health insurance, and most people that have good health insurance don't necessarily have eye health care. So that's a special thing for us, and I think we're looking for what you care about, and we can match that with our need. I know a little bit about your foundation, and I really want to give you something to think about when you are considering one of those areas of interest. I don't know whether it's medical care or dental care or eye care, but if you have a thought about that or you want to talk to your board, I'd be glad to give you more specifics around that.
Well, I think that we're interested in meeting the immediate needs of an organization. So we don't want you to do we don't want to do the guesswork on what's important to you. We want you to tell us this is what we need to best help our patients now.
Okay.
So I will ask you to submit an application.
Okay.
But it's important to talk too about how you will measure the success of that intervention or that work. And in order to receive or be eligible for annual funding or even like a multi-year pledge, the measurements and reporting will be essential.
Absolutely. And we're more than happy to do that. We are so excited about being in this space and the growth we've been able to see in meeting the need. It'll never be great enough to meet the whole need, but last year we had a 17.5% increase just in the number of patients visits that we were able to accommodate in our medical clinic. So that tells you the demand is there. I would hope that you all, because you see where the need is greatest, that you would give some thought to helping us fund a provider for our urgent care clinic. We need someone there full time, and we need to be able to get that funding seeded so we can build that up and work for some other sources of funding over time without waiting to do just incremental increased fundraising. So multi-year commitments are very, very important to us when we make a commitment to add a position like that.
Okay.
So I would love to share that salary with you and let that be your consideration.
Well, I will send you the link to apply, and then our deadline is December 1st. Okay. So I look forward, and we can talk again before our board meeting in January.
That sounds great, Jenny. Right. Thank you, and I hope you'll make an appointment to come down and get a tour, because we'd love to show you around.
Look forward to it.
And make sure you get to see the urgent care clinic, and hopefully you'll come early in the morning and see what it's like when it's a little bit crazy in there. Okay?
Sounds good.
Right.
All right.
Thank you.
Thank you.
Thank you.
Rock on.
Money. Did I get the money?
Did you like our
acting?
money? Tune in in January.
So, just to sort of some of my observations, and I like the way that you built rapport at the very beginning by asking Jenny about her interests or sort of personal interests, why this space issue. I mean, I think that rapport is really crucial. Building relationships with funders takes time, and people give to people. So making that connection, I think, was really, really important. I like, and the way that you included the demographics. The need, the 100,000 uninsured individuals, and you were able to respond to a question that I bet will get asked by everybody that's on the other end. Hasn't Obamacare fixed this? Why are you still around? And being able to address that 100% of the federal poverty level. If you're below that, man, there's no help. There are no subsidies. You don't qualify for Medicaid, most likely, in at least the states that didn't expand. So that was good. And I love the way you built a patient story in with the hairdresser and sort of tied it into, Jenny, next time you're, getting your hair cut, ask your hairdresser, do you have access to health care? That's sort of a bold thing to do, but I think, Marty, every time he's in a cab or an Uber, he's talking to the driver.
Yeah.
You have access to health care, and just to find out what they're doing in their community.
It's amazing how many of those people will then tell you their story.
Right.
Yeah, and actually, I mean, I was reluctant to break from our character, but actually, the woman who does wash my hair when I get my hair cut, which is more often now than it used to be, actually is a patient and has been for about 15 years. And it's been, going back into my church health role, between Uber drivers and nail salons and landscape company, even if it's a neighbor or the tree trimming service or what have you, so many people have been patients of ours at some point, and are so deeply appreciative of what care they've received. Yeah.
Right.
So,
And Jenny, I like the way that you wanted to make sure you understood what are your needs. What does church health need to make its program run better, and that sort of led to a conversation about the different areas of care that church health offers, and then you got to eventually the ask, which was, I'd love for you to fund the salary of one of our providers or a new provider. And so I love the way that it was specific. I think being to attach a real specific purpose for the money that you're asking for is much more important than just saying, well, we need operational dollars, or I guess if you're doing a capital campaign, then you've got a specific, we need a building. But when you're operational, it's a little more challenging to identify, what can your money do specifically in our organization.
So, John, I would add to that, I have dropped the word operational funding from my vocabulary because I don't think people have a way to identify that with another human being. It sounds like the lights and the water. People don't understand that it's the people that provide the care. So you just have to think about your vocabulary a little bit because people interpret it, and be as specific as you can.
I was going to say too, in that funder role, you're going to encounter some grant makers who really want to meet a need. Like I was trying to be, where it was all about what is church health, what are the church health priorities, what are the urgent matters that need to be funded. But understand that part of that get to know you conversation is to gauge, is that the way they view this, or is funding about them more? I mean, is it driven by, we want to accomplish X, and you, nonprofit, are going to help us do that?
Especially in corporate fundraising, that's a big difference.
Yeah. So it can be, but it could be a corporate thing, like, we sell widgets, and so we need people who are going to, help us reach more widget customers, or you're going to make us look better for the widget customers. But in other cases, it may be, Grandpa Joe was really interested in Y, and so therefore we need to sustain programs that Grandpa Joe would enjoy. So knowing kind of what is their motivation is important, and then also what are they looking to get out of it, because sometimes they're moved by the stories and sometimes they're moved by the numbers, and being prepared to put both things, which Anne did very well, is having the numbers, but then also having a personal story to sort of hit both types of.
And you set yourself up for listening for the personal side too, because you kept talking about my grandpa wanted people to have access. It wasn't like my grandpa wanted to address healthcare.
Yeah.
I mean, it was more about the one-on-one. So the little nuances in what you say make a difference in how you respond to it. So.
Yeah, if there was a lesson that came out of this for me that I think everyone could benefit, was Anne's approach of providing community context in the beginning, letting the potential funder know that this is really what the need is. A lot of people don't understand it, but here's what it is. Yeah. And that's where the data came in. And so if you have the opportunity to have one of these meetings, you want to make sure that you've got those facts in a row, that you've done your research about your community, so that when you start talking about your organization, you can describe how your mission fits into that context. And then to move into the personal and the people. Here in this interchange was very smooth, and Anne was prepared to do that as well. So I really think one of the lessons here is you need to be well prepared going in to talk to both those issues.
Yeah.
Marty, I would add to what you just said that there's some things about each community that will differ, and I would actually think about what would I ask, okay? What is it that now that I know the inside story, I need to be prepared to answer those hard questions. One question we get often here in Memphis is, well, doesn't the federally qualified clinic take care of everybody that falls into this category? And aren't they your competition? And our response to that is very honest, which is heavenly days, no. There is no competition to take care of this many people that don't have access to health care. We want them to succeed as much as we want to succeed, and we need to work together. But if you're in other communities where the hospital may have a clinic, people think people rely on the emergency room, you need to be prepared to at least give your response in an honest way to what that is. And if you see competition, you have to own the competition too.
Yeah. Yeah, and that's, speaking to that, I was in a fundraising webinar over the summer, and they were saying describing how important it is to stay apprised of your funders' activities, your competition's activities, and stakeholders. And they even suggested setting up Google Alerts for each of these organizations. So if you do have, whether it's a federally qualified clinic or a dozen prospective funders, set up news alerts, because the last thing that you want to do is come in with a big ask and find out that they had a really bad quarter. So, or there's been a shakeup in leadership, or
Grandpa just died last week. Yeah.
Right. Or they're in the midst of a strategic plan, and you just don't want to be tone deaf to what's going on with the business or the climate with that particular organization. And then at the same time, oftentimes, you see this sometimes too, where organizations sound similar on paper, but people will ask you about the other organizations and saying, well, and assuming, well, I don't work for them, so I don't really know, oftentimes it sounds like you're a little bit out of touch with the marketplace and the industry when that happens.
Okay, so can we transition to some tips for the folks online who are still in the development phase? They haven't opened yet, and so they're at a really crucial time in their fundraising where they're sharing a vision, and they may be able to grab some patient stories from from sort of anecdotal experiences. But what tips would you give to these folks about making their presentation and preparation for that?
I'm going to talk about this one first.
Okay.
So I think what we had, there were several different things that we felt were important to consider when preparing for an ask, but specifically related to an early stage organization. I think obviously at that point you have fewer stories, fewer information about what has happened, and need to really speak to the vision and the strategic plan to meet a need. The statistics that Anne shared around the population health, lack of resources, chronic disease, whatever those things are that your organization seeks to address, are the things. It's basically making a case for why are you doing this, and why you.
Yes, why you is very important.
And so, it's those types of things. I think it's an opportunity to build credibility, demonstrate that passion and energy, and then also highlight who's come on board with you so far, who has taken this leap, and who is going to be ensuring that you not only have good care available, but you also are mindful of who needs access to your services, and representing the faith community, the healthcare community, other community partners. I think those types of assets are useful in reinforcing how committed you are to fulfilling a mission.
And I would add to that, Jenny, because I totally agree with when I said, especially you, particularly in the role of founders and those engaged in startup, people will catch your passion. I mean, you have committed in a serious way to this, and you need to tell that story. It doesn't need to be a 30-minute story, but it needs to be the real core of what has led you to want to open a clinic and do this work. People need to see that in your eyes and feel it in what you have to say. And hopefully, working with John and Marty and Echo, you've got a board at least that's in the process of forming. Even if you have 2 or 3 people that have come on board, being able to tell a little bit about what attracted them to being part of this, it will get other people understanding that there's something they want to get excited about. Mm-hmm. Make it real for them.
Yeah. One thing I observed 3 days ago, I was in a couple days ago, I was in a meeting with Dr. Morris, and we were meeting with a prospective significant donor, who has both corporate reach as well as like a very generous congregation that has yet to be engaged with church health. And, it occurred to me while Dr. Morris was speaking about church health, what he was saying and the passion that he had behind it was probably similar to what he had 10 years ago, 20 years ago, 30 years ago plus. And, what is important too is that even if it seems like I've said it this way 1,000 times, you're going to say it probably 10,000 times more with tweaks.
With that same energy.
And that same, And so, and it's just that to me, and it's that same thing whether you're on the radio or you're talking to a funder, that I think that people, like Ann said, that passion and that willingness to sort of persevere is going to set you apart from other organizations seeking funding from the same organizations.
So one thing Jenny and I talked about right before we started talking with you was a couple of the sticky questions, and Jenny set it up beautifully for me to be able to answer when she talked about her sister-in-law, I think it was, that's Jewish on the board, and gave an entree there for an answer that was easy for me to respond to. That's not always the case, and you will be asked this question about being a faith-based organization and whether organizations should support something if they don't agree with what your quote religion is. Our advice on that is, one, if you're going to follow a church health model, is to be fairly broad in that this is about bringing faith communities together and engaging as many people of faith in supporting people that need assistance. That may not be where you're coming from. You may be affiliated with one denomination or one particular, line of thinking. You have to be authentic and honest with that. If you can be Switzerland, which is the way we think of church health in that regard, in terms of not saying this is what you have to believe, that's one way to go. But think about that before you go in, and be comfortable in your response and how you as an organization and as an individual are going to respond to that, because you will find that question more often than not as part of it. And depending upon who you're calling on, whether it's somebody that's a bank president versus a family foundation that may be intimate versus a big foundation, you're going to find a lot of differences there, and you need to be prepared and think about that ahead of time so you don't feel uncomfortable.
Yeah, I think is the important point there.
Absolutely.
You need to be able to sort of react when you get thrown a curveball.
Yeah.
And, I think you hit upon the energy of the presentation. I think, passion sells. And so,
John, you cut out. Say what you just said again. Say what you just said
almost
again.
have to rely upon that passion for
Passion.
what they're talking about doing. To be able to get that across. How about we open up for any questions that you folks have, and you guys can unmute yourselves and ask your question, and then maybe mute back to get the answer.
Hi, John. This is Mariko in Arkansas, and so I had a quick question. I got kicked off there briefly for a moment, so I may have missed this, and I apologize if I did. I just had a question on how you actually come up with the list of individuals that you are going to be asking of or from.
Your prospect list.
Yes.
Okay. Well, I'll go back, and Jenny's doing this now, and I did it a long time ago, but I'll try to go back to some of the early days. You rely on your friends and the people that are close to you. We actually had a group that included a pastor and a bank officer and a real estate person that just caught the passion early on, and we would sit literally with them and say, who do we need to go talk to? Who do you think cares about this issue? If you're not familiar with those people in your community, you need to get other people to help you. But the benefit of getting other people to help you is, even if you go on your own, being able to make the appointment and saying, Mr. Friedman sent me and told me that you're somebody I should talk with, that makes a big difference. Hopefully he'll go with you. But that's the way you build that list. It's clear in most communities, and in Arkansas, I know this is true, what the local foundations are. The other place that we found has been hugely beneficial over the years is working with your community foundation and finding out people there that may have an interest in what you're doing.
Yeah.
Okay.
And know too that creating a prospect list is a constant discipline.
Right.
Literally, we had a meeting this morning about it, and we have 3 more set up over the next week with our development team. So it is, going back to your friends, like Ann described, but it's also what are some areas where we need to start carving new opportunities.
Okay.
Yeah, that's a 365-day-a-year project, and the beauty is right now you can carry this with you, so you don't have to make a big scene about it. But you meet somebody and they mention to you that they know John Doe, put that in that notepad or send yourself an email, and make sure you follow up with those. I mean, if you're at a dinner party and Jenny says, oh, by the way, you didn't know my best friend is so-and-so. Well, you've been wanting to know so-and-so. You're not going to ask Jenny to go ask them for a gift.
Right.
But by golly, if Jenny made the phone call and said, you want to come, likely you'll get there.
Yeah.
Great. Thank you, ladies, for the response.
So another idea is, if you've got larger nonprofits in your community, you can pick up their annual report and flip through the donor list and say, who knows John Doe, who knows Phil Smith, who knows, and that sort of prods you to say, okay, well, there's somebody that we can potentially approach because maybe they have more capacity.
That's also a great way to learn capacity and interest in donors in terms of their giving level. My husband used to laugh at me and say I made donations to organizations just so I got their newsletters and annual reports and could sit down with my red pen, and I still do it.
Yeah.
It's especially, I mean, as times change and new people move into the community, you're not going to know. Watching those local, social newspapers that come out and meeting people that are giving to organizations, you got to play the game.
Yeah.
And people appreciate being approached. That's the other thing. I will just say that about fundraising. People really do.
Yeah.
Thank you.
Next question.
Who likes to ask for money? Okay, so my question back to you is, what is it that makes you hesitant about asking? What is it that makes you go, oh, I don't want to even hear this conversation because I don't want to do this? Anybody got a confession?
I think I'll confess. I feel like the telemarketers have me on robocall on my cell phone and my house phone, and it's like somebody's always calling asking for money.
Yeah.
Okay, well, you won't be that. You will be a face-to-face person telling something you really care about. And that's a big, big difference. It's all personal to you.
And I think one of the things too is that when you do talk to individuals or organizations, meet on their turf. Go to them. It might take a chunk of the day, but be armed with materials, be armed with your story, and so forth. And maybe even take a board member with you, but especially, of course, if they know the person on the receiving end, but that those meetings kind of in their comfort where you're doing everything you can to sort of accommodate their busy schedule will go a long way.
Great, thank you.
So back to that prospect list question. Another place that early on we developed a lot of people to add to our prospects was actually going out and speaking at Wednesday night suppers or whatever the latest thing is that's going on in churches. A Sunday school class often wants somebody to come talk about what the newest organization is in town. And I mean, people will come up after that and ask questions, and one thing leads to another. And to me, that is still the greatest place in the world to just tell your story and see who gets it, who expresses an interest.
All right, thank you.
Any questions?
Other questions?
Other questions?
I was going to share, we talked about personal story and Ann shared something, and I think that's so important. But as an early stage organization too, you may not have a patient success story, but you may have a story about how you talked a primary care physician into volunteering. You may have a story about a colleague, one of the other people on this call, who you met at replication and she or he has inspired you. So I think that thinking kind of beyond the sort of a success story or defining success in a broader way. Even I know, speaking for myself, depending on the context, I've been at Church Health now just shy of a year, and sometimes I brag on my colleagues, sometimes I brag on a volunteer, sometimes I talk about something I observed in a clinic. I mean, I try to tap into different things so that people can understand the level of compassion that is, and the sort of the calling that people feel to be part of this. So, those things that can tell people more about our organization and the trust that they can have in us using their funds responsibly.
Or even the response that Marty or John got to from an Uber driver who tells their story about their struggle with healthcare. That gives you a patient story, even though they're not yet a patient.
Yeah.
It's a story about the need. But that personalizing, it makes a big difference.
So I think we all tend to want to use technology and slides and PowerPoints and you were just having a conversation. So where do you draw the line between, having a 30 slide, deck ready to unleash on someone versus just having a conversation?
I think it depends. So I think that you have to be prepared for both scenarios. Because, this was we kind of knew each other, and I was at the Family Foundation, and clearly we were interested in healthcare access. Not every fundraiser is going to be that easy. And, others are going to say, show me what you got. And so you have to be, 30 slides would be totally overkill. I would say 5 to 8, but it's, again, knowing your audience a little bit,
Mm-hmm.
but knowing that even if you don't even open the folder, having it with you and being able to speak to the need, the leadership,
Yes.
the target audience, the goals, and then even specifying, not necessarily with numbers, but like what are sort of the urgent needs?
Yes.
What help are you seeking at this time?
And I think it's really nice when you leave, especially somebody like this, or not in this situation, but where they don't know you and you're trying to just start building a relationship, have just one piece of paper that you leave with them. Don't leave a big fat folder with 20 things and flyers and everything else, but something succinct. So if they're going to go in and talk to their spouse or talk to another business person or somebody else on their board, it's almost like their notes from what you've described.
Yeah.
So they can go back to that is, I think, very helpful. And I'll often, if I don't leave it, I will send it in an email right after the meeting and say, just thought it might be helpful for you to have a few key points if I know I talk a lot and fast and, cover up for it.
Mm-hmm. I was just going to say, like, you don't want to be empty-handed.
Right.
But like Ann said, you don't want to, kill them with lots of paper.
Yeah. I have a bias against fancy, flashy things because I like to be able to say we don't spend our money on flashy, fancy things. But you want something that looks very professional, that looks like you've got your act together, that shows that you know what you're doing and that you've got the ability to deliver. And one of the other things that Jenny and I had made a note about that I think is often asked as a question for us is, how are you going to sustain this? Mm-hmm. And I know as you're working on your business plans for your clinics and all, you need to talk to people about they need to be a part of that. I mean, that's really what's the conversation starter in a community is we're here today to begin to build a base of people that want to see this work being done until the problem goes away. We don't believe that'll ever be the case, but we would like to see it go away, but we want to be in business as long as it takes to serve the need. And we need you to be a part of building that. Those are also the people that will stay with you for the long haul. I want to point out one other thing that I forgot to point out that was a part of intentional in the discussion. Jenny opened the door, which very few people do, but I also have a bias for asking for multi-year gifts. And especially in your early years, it doesn't change now, but it makes such a difference for you if you ask for something, even if it's 2, it's nice for it to be 3, but that will give you one leg up for next year because you've got one donor already to start the next year with. And in a startup organization, I think saying we want a multi-year gift in some ways also really conveys that you're going to be around and that you're going to be growing, and it puts that stake in the ground.
Great. Well, ladies, we're almost at an hour, so I just want to thank you for your time. Oh, Kathleen, did you want to ask a question?
I did, and just to follow up on what you just said about them, this is Kathleen Jeter from Chattanooga. Thank you, ladies, both for doing this.
It's so good to meet you.
Yes. Just following up on what you just said, Ann, about the multi-year gift. I know that kind of one of the big tips that stood out to me is to be specific in our ask. So not knowing and can't predict the future. I think there will be some things that we kind of know ongoing that we're going to need money to support that, such as, paying the staff. But when you ask for that multi-year gift, do funders want to know specifically in the future what that money is going to be for?
Yes.
I'm just kind of figuring out what does that
Absolutely. That's why you need to pick something you know is going to be an ongoing need. We have a little bit of a rule around here that we don't ask for things that we don't know we need. We don't make it up as we go. You're driven by what's in your budget, and you know that a lot of those things are going to be there year after year after year. So salaries are there, supplies are there. I mean, the things that make your clinic run. And you don't always have to say, I want you to fund this position. You can say, we have a receptionist and we need a group of 5 people that help us make sure that we've got somebody on that phone and at that desk, 5 days, 6 days a week.
Mm-hmm.
And
Gotcha. Okay.
you'll always need that.
Okay. Thank you. Thank you both.
One thing, if I can just add one other piece of advice. Prior to joining Church Health, I was in philanthropy, and I worked with a lot of different nonprofits, some who would, in making a proposal, clearly were trying to create something they thought we would like, but it was obvious it was off mission. And so going back to Anne's comment about authenticity, but really knowing your needs. I mean, if you're going to whether it's a bank or a retailer or a, consumer products company or whatever it is, or I'm a flower shop, like it could be anybody. But I mean, be true to who you are and what you need. Like, don't try to create something just because it sounds like it would, don't create like financial literacy services for your patients, even though Lord knows that they need that support. Create a partnership with the organization down the road who does that. Refer your patients to them or what have you, but make sure that you're focused on the stuff that you need to keep the doors open and the, patients' care going first and foremost. And I think that they will respect and appreciate that focus.
We know our scope, and this is what we need to fund. We don't need to be adding to it at this point in time.
Yeah.
We'd like to do what we're going to do well.
They're chasing money. That didn't come through.
It did not come through. Say it again, John. It didn't come through.
I said more than one organization has been moved off their mission.
Yeah.
Yes.
Absolutely.
Yes. Mm-hmm. Yeah, we think you need to do this, so therefore we'll fund this. And then you go, what in the world have we done?
Yeah.
We've all been there, trust me.